Sir, మీకు visible ఉంది sir మీకు.
Visible గానే ఉంది. It was visible to me.
Yeah, fine. Visible, sir. Screen is visible to you, sir?
Yeah, screen is visible.
Slide. Yeah, slide. Slide is.
కొంచెం zoom in చేయండి. Zoom in చేయండి.
Okay.
Yeah.
Yes, sir.
This is the novel 3-dose regimen of G protein vaccine. Ultimate key for the compliance.
Second sir, next side. Sir, next side.
Next slide.
Yeah.
When you come to the rabies, as a whole, we can say it as a rabies is a public health challenge throughout the world, which needs to be addressed properly, even for a developed country or a developing country, whatever may be the country. Globally, we can see 59,000 humans deaths were reported annually, of which India accounting for up to 20,000 of the deaths for, because of the rabies, of which 60% of deaths of in the Asia, and 35% globally. 91% of the deaths were happening in the rural area. The main problem lies with the deaths happening with respect to the rabies. The main problem was patient compliance will be majority of the times lost. When we advise for vaccination doses, the patient will be having he comes to the first dose, second dose, and third dose very eagerly until the wound shows some improvement. Once the wound shows improvement, he stops coming for the vaccination. That is a problem which may leads to a lot of this type of deaths in India. So I hope so. Next slide, please. Yeah, when we come to the management of the rabies proper, local wound management was a key aspect. What we explain to every patient and every individual in a large scale when we come to our clinics or in the hospital or in the public health sector, where the multipurpose health workers will be motivating all the field workers, in the fields, demonstrating the importance of the wound care. That is immediately after a dog bite has happened, the wound must be thoroughly washed with clean water and soap, whatever available with them. But majority of the still public were lacking in this aspect, which was also one reason which may be leading to the infection to go through the nervous system and getting a lot of problems to the concerned individual. And second thing was, whatever right now we are practicing active immunization, that is in the form of already existing vaccine. What we are obtaining the recombinant DNA technology, we are giving virus-like particles to the individual, which are inactivated actually, are giving the part and parcel of the vaccine, part and parcel of the virus. And third thing was passive immunoglobulin. Generally, we reserve the passive immunization, that is rabies immunoglobulin vaccines for category 3 type of wounds. That is where the wound was severe, where the bite was severe, we can say in that sense, which would take care betterly. That needs to be given locally so that the patient will get more benefit with this work. Next slide, please. Current challenges with respect to the post-exposure prophylaxis. We are mainly concerned with post-exposure prophylaxis. Only some professions were concerned with respect to the pre-exposure prophylaxis. Just like we are dealing with the veterinary services, just like people working in the veterinary department or veterinary as a veterinary assistant or a veterinary people in the department of veterinary or people who are working in the municipality department, who would be frequently exposed and was need to tackle the things with respect to the public health challenges. The main problem lies with the current vaccination schedule is, we know that previously when we used to a childhood and in the many of the movies were also, whenever a dog bite says, they used to say that we have to take so many injections around our umbilicus. That was the previous saying. With respect to the improved technology, whatever available in the present day, from past neural tissue cell culture and present to the cell culture, and now we are in the era of golden era. We can say that is recombinant DNA technology, with which we could able to get the very good vaccine available for us. The main problem was, even though with time the number of vaccination doses required has brought down very drastically also, but there is still lack of some compliance with respect to the taking the vaccination. So majority of the things, whatever documented deaths or documented problems happen or the reported cases of rabies were mainly because of not taking the vaccine only, not because of the other issues. We can say that. So with respect to non-compliance, currently rabies vaccine, whatever we are using, cell culture vaccines and now recombinant DNA vaccine was also available. Inactivated vaccines for whatever the past technology, old technology has been using for more than 50 years, which is inconsistent in potency, stability, availability of short supply. Those were all previous issues. Now it was supply was a bit better. We can say that. Next slide, please. But on and off supply was problematic, and even availability outside also very non-compliance to 5 doses. Yeah, you can see the slide given there. They have one hospital at Delhi. They have studied the case reports of reported cases of rabies and deaths happened due to rabies. What is the reason? So with the data analysis or the data compiled, one could able to see clearly see that they were living against the medical advice was the one big complaint, or not accepting the not follow up giving follow up for complete 5 doses, which was the main problem. The reason for deaths due to lack of administration of rabies only, rabies vaccine. Rabies deaths were proved to be because of the non-compliance in these cases. Next slide, please. Slide. Next slide. Next slide. Yeah. Compliance in case of post-popular. Yeah, but this is the what study we are talking about. Where at Sartinga Hospital, Delhi, 360 patients, 360 animal bed patients were studied. Of these, 53% were non-compliant to full course of ARV, which we can see how much rate was non-compliance, which is quite pitiable situation where they might have some developed some immunity and but not have gained the complete immunity as per the proved studies, which the patient has failed to cope with the system. Next slide. Next slide. And yeah, you can see the same thing here. They have explained in different modalities. Constraint in for compliance was also reported. The main constraint what we can see in the main constraint with respect to different peoples, different community people. When we speak about from small age group to a large age group, for small age group children, the parents will complain that they were losing the school, or the parent will not be bringing them to the hospital for taking their vaccine. And when we come to the earning people who are in the society, they think that going for pure vaccination to a hospital may lose their wages for that purpose. And in some cases, some old age persons, they will have been neglected and they will not be people to get them to the hospital for the scheduled time. And some people with their routine activities and different things, they may even forget. And some people were not able to pay money for 5 times or 6 times for traveling from one place to another place to get the vaccine. These were all the things, and simultaneously they were not able to afford outside also. This was the problem because outside the vaccine was a bit costly affair for them, so they could not able to buy it. At the same time, they could not able to spend the required expenditure for traveling to the nearest hospital also. These were all the common things which we can see in the day-to-day life, which were leading to non-compliance of the patient with respect to taking the vaccination. Next slide. Yeah, this is a slide we are talking about previously, where in previous days, yeah, you can see here, they have given how many doses you are taking. When the vaccine was initially prepared in 1885, at that time live attenuated vaccine, which used to be used at that time, used to be up to 31 doses, which has been brought down to still less doses of about 14 doses in 1970. And currently, whatever we are following, which is derived from cell culture, that is inactivated vaccine with recombinant DNA technology, we are using only 5 doses, which these 5 doses has been taken on the day of bite, that is 0 day, 3rd day, 7th day, 14th day, and 28 days. These were all the doses currently we are following. Next slide, please. Yeah. From that particular point to right now, Cadila company has launched a 3-dose recombinant rabies G protein vaccine, which they have been prepared by using the VLP technology, VLP platform technology. This was the first vaccine with 3-dose intramuscular regimen only, which used to follow same as previous vaccine, intramuscular dose only. The number of doses has been brought down by 2 doses, which patient can easily take, because whenever the patient has a bite with the respect to dog and he has a bleeding, then until that wound heals, he pays more attention towards that wound. That is the ideal time where we need to capitalize and give the vaccine, so that the patient will be with us for that particular period. Once the wound starts healing, he might automatically neglect or forgets. Some people are good enough, they will come and take the vaccine. Majority of the people will lose the compliance. That was the main problem. So the whatever the company has brought up the vaccine with respect to the design was good enough for good compliance of the patient, so that majority of them will complete the course and have the complete benefit with respect to the vaccination and with respect to the rabies also. That's what we can hope in the future. Next slide, please. A bit zoom. Can it be a little closer? Yeah, this is the VLP technology we are talking about, where the isolation of the G protein was a bit difficult task, where the company has taken it as a serious, taken it in a very good manner, and they have taken, they have extracted the G protein. With that G protein, they have brought the vaccine by targeting the G protein. They have brought the VLP as a VLPG as a vaccine, so which is quite appreciable, and we hope so. The specificity and the effectiveness of the vaccine was also good up to this time. Yeah, next slide.
Srikant sir, next slide, sir.
These were nanoparticles, which
Yes.
yeah, because they have been, they did not have the property to replicate anymore. That is the most safety and immunity of novel 3D recombinant DNA nanotechnology, nanoparticles of rabies Z protein vaccine. Sorry. Okay. Okay, right now it was the phase 3 of clinical trials, where we are using the recombinant nanoparticles for the study.
Srikant sir. Hello.
Hello?
Srikant sir.
I
Sir,
think
slides.
we are done with majority of the slides only. And only slides we have left out is, I think, the specificity and the sensitivity of the
Yes, sir. Please slide. Efficacy and safety.
Srikant sir.
1 minute.
The screen is visible, sir.
1 minute. A bit. If you can increase a bit, I can able to see it betterly. Because I was going through from the mobile. I was thinking from the mobile now. Yeah, you can see it. Okay.
Okay. Efficacy and safety.
Yeah, we can see with respect to the efficacy and seroconversion, seroprotein, protection on day 14 and day 42. Where the seroprotection has been very good with respect to the rabies vaccine, where the seroprotection on day 14 was 99.24%, and on day 42 it was about 98.69%, which was quite good enough for protection from the rabies vaccine. But still large scale of studies needs to be conducted, and when the utilization comes into more and more, so that the things will get better and it will be more validated. Hello?
This is the last slide, sir. Study conclusion.
Yeah. Novel 3-dose non-inferior to reference vaccine. Whenever we are conducting any of the research studies, we know very well. We compare already existing product with the newly brought product. When we see the product, it was no way inferior to the already existing vaccine, and whatever the company has brought up with respect to compliance and the dose reduction from 5 doses to 3 doses was very happy and acceptable issue, and it was also simultaneously having less adverse effects when compared to the previous vaccine. And novel 3-dose vaccine was found to be safe, and even it has got good immunogenic response, and the titers whatever developed with respect to zero protection or zero conversion, what we say for all as per the WHO guidelines, with respect to already approved vaccine, so it can be very well utilized in the market and for the welfare of the human being. Thank you.
Sir, thank you so much, doctor, for the informative talk. To truly appreciate your efforts. Last but not least, we would like to inform you that rabies has won the 2 prestigious awards in innovative category: ET India Pharma Awards and Golden Globe Tiger Awards. Sir, thank you, sir. Thank you so much.
Congratulations to the unit. Thank you.
Thank you, sir. Thank you, sir. Thank you so much, sir.
I'm leaving the meeting. I have some
Okay,
work.
sir. Okay. Okay, sir. Okay, sir. Okay, sir. Thank you, sir. Thank you so much, sir. Madam. Hello, Parul, madam.
Yes, sir.
Madam, just now completed, madam.
Yes, okay. Tech support, kindly conclude the session. Tech support session complete हो गया. ठीक है, Suresh, you can log out. No issues.
Okay, madam. Thank you, madam. Thank you so much.